व्रणालेपनबन्धनविधिम् अध्यायं व्याख्यास्यामः यथोवाच भगवान् धन्वन्तरिः। आलेपः आद्यः उपक्रमः। एषः सर्वशोपानां सामान्यः प्रधानतमश्च तं च प्रतिरोगं मोक्ष्यामः। ततो बन्धप्रदानं तेन शुद्धिः व्रणरोपणम् अस्थिसन्धिस्थैर्यं च। Alepa is considered as the most important method of treating the localized diseases, particularly shopas, and it is considered as pradhanatama, the most important. So local application or topical application of medicine is one of the important methods of treating the conditions in Ayurveda, and the Alepa is considered one of them. Tato bandha pradhanam. After that, the next is the bandha. That bandaging is the next condition. Tena shuddhihi vranaropanam asti sandhistairyam ja. Because by using the bandha, you will have the wound to be cleaned properly, and it also facilitates the healing, and it gives the support. So bandaging is considered having two aims. One is splintage, giving support, and the other is protecting the wound and facilitating the healing. Now, as far as the lower is concerned, tatra pratilomam alimpeta. Whenever the application has to be done, the application has to be done against the direction of the has. Now, this is to facilitate the contents to get into the material, the physical content to get into the pores of the skin, the follicles as well as the sweat glands. प्रतिलोमे ही सम्यक् औषधम् अवतिष्ठते अनुप्रविश्यते रोमकूपान् स्वेदवाहिभिश्च शिरामुखे हि वीर्यं प्राप्नोति. When you apply the lepa over the surface against the direction of the hairs, it will facilitate the movement of the contents, the virya of the dravya, into the circulation. This part, that microparticles, I will come to that part at the end of this discussion. न च शुष्यमाणमुपेक्षेत अन्यत्र पीडयितव्यात् शुष्को हि अपार्थकः रुक्करश्च. Whenever the lepa is applied, there are two important conditions. One is the lepa should not be allowed to dry except in case of the pidana lepa. One of the methods of, or one of the aims of the lepa would be to produce a compression and hence facilitate the drainage of the contents. In that condition, it's allowed to dry. In other conditions, it's not allowed to dry. And the other is every lepa should have some oily content, sneha content, some material which is something like the fat substance, which facilitates the absorption of the fat soluble content. So there is a biochemistry in it also. Shushko hepartakaha rukkarashta. A dry lepa would not serve the purpose and it can produce a pain. Now, with the lepa used for the shofa, Sushruta has categorized them into three categories. They are तत्र त्रिविधः प्रलेपः प्रदेहः आलेपश्च. प्रलेप प्रदेहयोः अन्तरं तत्र प्रलेपः शीतः तनुः अविशोषि विशोषि वा. प्रदेहस्तु उष्णः शीतो वा बहलो अबहुः अविशोषि च. मध्यमो अत्र आलेपः. Now pralepa is a cold lepa applied in the cold condition, and either it's allowed to dry or not allowed to dry. Dry in case of the pidana lepa. Pradeha is usually shita, or it could be even warm also, and it's applied as thick. So thickness of the pradeha is one of the categorization of this lepa is based upon the thickness. In another context, you will come across the description. Pradeha is ardha mahisha charma utsedaha. The thickness is as thick as of the skin of the moist leather of a buffalo. So it's around half an inch. So pradeha is applied as half an inch thick lepa. Pralepa is a thin, very thin lepa. Madhyama atra alepa. Alepa is somewhere in between. So that's how the categorization is done based upon the thickness of the lepa, so that the amount of the contents which reach to the body and the time taken for the drying of the lepa would be the varying variations in these lepas. Rakta pitta prasadakata alepaha. The alepa is for treating the patients with the rakta drushti pitta drushti, because it's shita and then it's applied thin acid. Pradeha, a thick lepa, is for vata shleshma prashamanaha, for diseases of vata and kapha, because it's applied thick and it retains the heat. Shodhana ropanaha shofa vedanapahascha. It also helps in cleaning of the wound, and then ropana facilitates the healing too. And shofa vedanapaha, the swelling and the pain also will be reduced. तस्य उपयोगः क्षत अक्षतेषु. A lepa can be used over a wound or over a swelling. So whether there is a wound or not, disruption of the surface or not, is not the criteria. In both the conditions, where there is a disruption of the wound as well as there is no disruption, the lepa can be used. Yasya kshateshu upayudyate sabhuyah kalka iti samnyam lavate. When it is applied over the wound, a raw surface, disrupted surface, it's considered as kalka, is named as kalka or niruddha alepana samnyaha. Another name given is niruddha alepa. So it's the same lepa, but because of that most moist content and applied over the interrupted surface, it's named as kalka or niruddha lepa. Then astayavasa nirodha mruduta puti mamsa apakarshanam ananta doshata vranashuddhishta bhavati. That lepa applied over the wound helps in reducing the discharges, makes the tissue softer, and removes the slough, facilitates the slough as such. अविदग्धेषु शोपेषु हितम् आलेपनं भवेत् यथास्वं दोषशमनं दाह कण्डूरुजापहम् त्वत्प्रसादनमेव अग्र्यं मांसरक्तप्रसादनं दाह प्रशमनं श्रेष्ठं रुजा कण्डू विनाशनम् मर्मदेशेषु ये दैवाः गुह्यक्षपिततान् संशोधनाय तेषां हि कुर्यात् आलेपनं विषयक. Now, in general, the purpose of the lepa is when there is not yet suppuration in the amavastha. The alepa is the most important condition. In the Shastra Upakrama, again when the Shofa Upakrama are described, again alepa is given that priority of treating that the ama conditions. In ama conditions where there is no wound as such, it is in the primary initial inflammatory condition, lepa can be used to reduce the course of inflammation or reverse the course of inflammation, and it also can be used for a healthy person to facilitate improve the health of the skin, prasadanam, and mamsarakta prasadanam. The deeper tissues also, in the lesions, pathologies of the deeper tissues of mamsa and rakta also lepa can be used, and lepa also can be used for reducing the burning sensation, pain and itching, all the dosha lakshanas, burning sensation, pitta lakshana, ruja, vata lakshana, kandu, kapha lakshana. So in all the three doshas producing the symptoms on the surface, lepa can be applied. And it also can be used in case of the marmadeshas, that's the vital areas, or gushyeshu, the genital or other areas which are to be concealed. Lepa also can be used for samshodhan, shodhana chikitsa. So the whole spectrum of the use of lepa is quite huge. Now, as I told earlier, in every lepa, a sneha bhaga has to be applied. Sneha has to be applied, and the ratio of the sneha would be षड्भागं पैतिके स्नेहं चतुर्भागं तु वातिके अष्टभागं तु कपले स्नेहमात्रां प्रलापयेत्. 1/4 of the content is sneha in case of vata, because in vata sneha should be more. षड्भागं 1/6 is that of in case of the pittaja vyadhi, whereas 1/8 is in kaphaja vyadhi, in proportion to the sneha guna of the doshas. In vata you need more sneha, so 1/4 quarter of the content is sneha, whereas in kapha it's 1/8 is sneha. Tasya pramanam mahisha ardhachakam utsedham upadishanti. Now that's what I said earlier also. The thickness of the alepa is mahisha ardhachakam utsedha, as thick as that of buffalo's skin, moist skin. Now other rules about the lepa are nacha alepam ratrau prayinjita ma bhut shaitya vihata ushmanah tad anirgamat vikara pravrittihi iti. Lepa are not applied at night generally because the environment is cold, and you apply the lepa, that helps that results in retention of the body heat, and the body heat doesn't get expelled out. So there is a huge temperature difference between the interior of the body and exterior of the body, and that itself can produce the diseases. It can result in the diseases. Now this hypothesis, like a difference between the temperature of the body and the environment, is one of the factors for producing the disease. Is a very new concept. Even it's now understood in the contemporary science too. And majority of the skin diseases now, very recently there are a few studies done because of the air conditioning, remaining in the air conditioning environment where the body doesn't get accustomed to the environmental temperature outside. So when you are in the air conditioned room, the temperature will be low. The moment you come out, the temperature will be high, and this kind of a significant fluctuation of the temperature can result in unhealthy skin. This is also now one of the recent research observations. So, whatever Sushruta has said about the labor resulting in the retention of the heat and resulting in the disease is a absolutely practically true observation. प्रदेहसार्गे भवतु हितमालेपनं दिवा पित्तरक्ताभिघातो ते सविशेष विशेषतः in case of in any of the Vyadhi diseases, particularly Pitta Raktaja Vyadhi or the Savisha Vyadhi, is always the lepa has to be applied in the daytime, not in the night time. Nate Parishidam lepam kadachid avatarayat, upari lepam chana kadachid pralapayat. A lepa should not be allowed to remain there overnight, because if it is left over there overnight, then all the contents will be dried up and it doesn't help in the absorption of the contents. And lepa should not be applied over a pre-existing lepa whenever there is a second lepa has to be applied. The previous lepa has to be washed out, because if it's not done, then ushmanam vedanam daham dhanatvat janayat sahi, that overlapping of the lepa can produce increased temperature or inflammation, pain can be triggered by this lepa applied over and over. न च तेनैव लेपेन प्रदेहं दापयेत् पुनः शुष्कभावात् सह निर्वीर्यः युक्तोऽपि स्यात् अपार्थकः. A lepa which is removed once should not be reapplied. A reapplication of lepa can result doesn't have the same active substances, and hence it doesn't really serve the purpose. Now, the lepa is used in Shastrirupakrama in different terminologies, and that's the topiceuticals. Use of local applications in the wound is a very advanced technique in Ayurveda, and Vagbhata urges. Sushruta has mentioned this in different names with the different purposes in the Shastrirupakrama. Out of these Shastrirupakrama, 60 Upakramas, Alepa, Pavisheka, Abhyanga, Upanaha, Pachana, Dharana, Sandhana, Pidana, Shonitastapana, Utkarika, Kashaya, Varti, Kalka, Sarpi, Taila, Rasakriya, Avachurnana, Utsadana, Avasadana, Mrudukarma, Dharana Karma, Krishna Karma, Pandu Karma, Pratisarana, Roma Sanjana, Lomabharana, Madhusarpi. These are all the different modulations of local application of the substance, which we call them as topiceuticals. Topiceuticals is one of the branches of the pharmacology where local application of the substance is used. In the current pharmacology too, you will have significant varieties of such substances used in the local area, and the most common varieties which are regularly used are either ointment, liniment, cream, lotions or gel. These are the common varieties of the substances which are used in the local uses, and their purpose or how they are to be used is ointment will be, when you say ointment, it will be waxy and fatty, oily based. It will be fatty as such, and it's supposed to be more potent because of the presence of the fat substance, and it is a greasy acid. Now, it's because it doesn't have a water content, it doesn't have a preservative. That's an advantage of the ointment. Ointment would not have a preservative, so chances of allergic reaction in a typical ointment would be lesser. Whereas in a liniment, you will have many of these preservative materials, many times irritant substances, and hence they can be producing allergic reactions. Risk of allergic reactions in case of cream and lotions are comparatively more, whereas with the ointment they are lesser. And with the ointment, it produces a hydrating, so it increases water content of the area. So whenever there is a huge discharge in the wound, a significant discharge in the wound, ointment better is not to be applied. The dusting is the other way. Now, of course, one more of the technique would be dusting, where dry powder is applied, and with the dry powder, you don't have to use these. In case of the presence of the discharge, dry powder is preferred. Whereas the ointment is used when the discharges are lesser. Cream, of course, is generally preferred not to be used in a wound area. Instead, cream is preferred over a intact tissue, intact skin area, because it can also produce a significant amount of water content there, and it increases the humidity of the area. So that's the differences. So many times when you have seen in the OPD or the ward, like when to use, and this is one a common question, the better in lotions and better in this ointment. The lotions are used when there is more of discharge as such. Ointment is used when the discharge is lesser. In a fresh wound, ointment is better. In a chronic wound, lotion is better. I think this was one of the questions which was asked by some of the students earlier. So, because lotions have more water content, they also have a property of cleaning. They do not stick over to the area, whereas the ointment sticks to the area. It is greasy. So that's the differences of the materials which are used. A pharmacology of toxiceuticals, application of the substances over the area and how they produce a systemic effect. This is also another of the vastly studied subject, and a substance which is applied over the surface can reach to the system through different routes, through the intracellular route or through the transpedagogial route or through the pores of the skin. Now this is exactly what Sushruta says, like when you apply the lepa against the hairs, pratiloma lepa, this would be facilitated. Then there is an intercellular route. For the intercellular route, the substance should have a solubility in the tissues, and mainly fat soluble substance can have a better penetration to the intercellular route. In the present situation, there are many other methods used to facilitate or increase the absorption of the substances from the surface. In Ayurvedic principle, it's mainly use of the fatty substance, sneha, and then warmth. Whereas in the present day situation, you have many different techniques used for facilitating the absorption of the substances from the skin, and it could be like microneedles. Ionophoresis is one of the more popular techniques, and which is supposed to have a rather promising future. So in the future, a large number of medicines could be applied through the ionophoresis technique. In the ionophoresis technique, you apply a patch of that drug over the area and then produce some electricity or charge that area with a low voltage current. That low voltage current would regulate or decide like how much of the substance could absorb into the body or not. So once the patient has sufficient clinical effects, then it could be switched off. Particularly with analgesic drugs, that ionophoresis technique now has become quite popular, and in a few years now, maybe in the regular practice here also, you'll come across these ionophoresis substances, where a medicine presented in the form of a patch and then a small battery and a switch, so that you can switch on and switch off of the pharmacological effect. And this is one of the supposed to be solution to avoid the possibility of overdosing of the drug, which is a major problem in the current pharmacology. That's a totally different issue. The other techniques which are used for facilitating this absorption are sonophoresis, where ultrasound waves are allowed, or there are certain new variety of instruments, velocity-based devices, where the substance is forced through the intracellular route by having that projection or injection. It's sort of a jet injection or thermal ablation, heating. That heating of the area also is another of the technique. So these are all the different techniques of facilitating the substances to be absorbed better from the area over the surface of the body. Now that's about the Vrana Alepa. The next is Vrana Bandhana. Atavurdhvam Vrana Bandhana Dravyani Upadekshamaha Tadyata Kshauma, Karpasa, Avika, Dukula, Kausheya, Patra, Urna, China, Patta, Charma, Antarvulkala, Lata, అలాభు శకల లత విదల రజ్జు స్థూలఫల సంతానిక లౌహానికి తేషాం వ్యాధిం కాలం చ అవేక్ష ఉపయోగः ప్రకరణతశ్చ ఏషాం ఆదేశः. Bandaging materials used in Sushruta were mainly of three categories. One would be the absorbents, substances which will absorb secretions like kshauma, karpasa. Kshauma is silk, karpasa cotton, avika wool, and dukula then the next is about those substances which can produce a covering over the area, cover the area. The dukula is silk, kausheya is a thick, dukula is a thick silk, kausheya is a thin silk, urna is again patra urna, leaf, or the urna again wool, china is again a Chinese silk, patta again a sort of cloth, thick cloth, charma the leather, andarvalkara bark of the tree, These are the substances which are supposed to produce a covering so that they can help in facilitating of the wound bandaging. Alabu shakala, piece of alabu or some lohani, metallic materials. These could be undervalkala also, could be used for splintage. So in the case of Bhagna Chikitsa, that undervalkala is mentioned as material of splintage. So that could be one category. Then the other category would be the substances which are used for tying the bandage, like lata, creepers, rajju, rope. These are the substances which could be applied over the area. In addition to this, there could be a moist application like santanika. Santanika is the cream of the milk, which also could be applied over them. So the options of bandaging materials used by Sushruta are of wide varying these potentials, and based upon the local the situation, they can be used. Now, based upon the shape of the bandage, Sushruta has classified the bandage into 14 categories, and they are Kosha, Dharma, Swastika, Anuvelita, Mutoli, Mandala, Sagika, Yamaka, Khatwa, China, Vibandha, Vitana, Gofanaha, Panchangi, Cheti, Chaturasha, Panda Visheshaha. So, technique of or art of bandaging is one of the important issue in the wound management. In the present day situation, because of the stickers which you have, it may not be of a significant practical issue because you have that adhesive tapes. Adhesive tapes have totally, the revolution is that the art of covering the wound, that bandaging. But earlier to that, that technique of bandaging was a very complex issue which needed lots of training. But still, even now, there is a, still every wound cannot be bandaged with only the leucoplast or these adherent plasters. You need to have the bandaging. So the skill of bandaging still is important, but may not be as important as in the earlier days. Now these bandages or the types of bandages are and the locations of their uses are Kosham Angustanguli Parvas Vidyapeeth Dama Sambadhe Ange Sandhi Kurchaka Bhu Stanantara Tarakarneshu Swastikam Anuvelitam Shakhasu Griva Metrayo Mutolim Vritte Ange Mandalam Angusta Anguli Metragreshu Stagikam Yamalam Ranayo Yamakam Hanushanka Gandeshu Khatwam Papangayo Chinam Prista Udara Vurasu Vibandham Murdhani Vitanam Chipuka Nasosta Amsagastishu Gopanam Jatunah Urdhvam Panchangi Miki Yo Yasmin Sharira Pradesh Sunimisto Bhoti Tasmin Vidadhyata. Now, what are these bandages? The Koshabandha is a capsule-like bandage, which was in those days, probably they might have used the silk shell, the shell of the silkworm, and it could be just fixed over the tip. So, Angustra Anguli Parvasu, at the tip of the fingers, they could be used. And in the commentary, the description is Puraita Aushadhi Bandha Kriyate Koshakakriti, Koshakakya Savijnyaha, Vaidihi Bandha Bandha Anavarjitaha. This is from Vagrada. The capsule-like substance, capsule-like structure is used to cover the tip of the fingers, the extremities. Now, with this, it gives a rigid support as well as gives a scope for keeping the medicines, whatever that contains, in contact with the wound. It produces a covering as well as the splintage of the wound. That kind of the bandage is the Koshabandha, which we now call as capsule. And the present day situation, you have plenty of options where synthetic materials or fiber optic materials of this shape are used, and they could be of that variety. Dama Sambhagyange. Dama is Dama Katim Chatushpadam Damakyam. Dama Bandha is a simple sling bandage where a cloth, piece of cloth is used to cover the area. It may not be good enough to treat a wound, but in case of injury, to reduce the movement and give support, a sling is used. That's the Dama Bandha. So in those conditions where there is acute pain, Sambhade Ange, to reduce the severity of the pain, a sling support is used, and that's the Dama Bandha. Swastika Bandha is where you will have a crisscrossing movement of the bandaging material, and Swastika Kratim Asivya Paschad Avesti Bedhate. So it has to be moved in a crisscrossing fashion, and then you have to put a tight bandage, particularly in those areas where the bandage needs more strength, and those parts of the body which tend to move, Sandhi, Kurchaka, Bhru, Stanantara Talakarnesho. In those areas where there is a possibility of more free movement, these bandages are applied, that crisscrossing bandage or figure of 8 type of bandage is applied. Anuvalitam Shaka. So Anuvalita simply a continuous bandage which can be used to cover a vaster area. If there is a huge area to be covered, then you just have a continuous movement of the bandaging material, and at the end you tie that area. It gives both coverage of the wound as well as a moderate support. It's not cannot be used as a splint, but gives a moderate support to the area, and it protects also. So Anuvalita is a continuous bandage as such. Griva Medhayoho Mutolim. The Mutoli is Bahvangrihi Mutikakaraha Jalavat Bahurandrakaha Mutoli Bandesha Syata Sanyantaram Atashruno Gotundikam Chalanincha Kamyahu Vishaparaha. Mutoli Banda also is named as Gotundika Banda or Chalani Banda according to Bhagavata. It's having Bahvangrihi. It would have multiple supporting structures, and it's used to cover the area of neck or maybe the scrotum. The scrotal bandage or neck bandage. It's exactly the similar shaped material which are used, but the materials which now use may be of synthetic variety, as in custom made materials could be used. For scrotum, you may have a custom made scrotal bandage where the opening for the support for the penis is maintained, and then the scrotal supports, the shapes are cut off. But Sushruta Bhatt, she has said, is having a bandage with the multiple coverings or multiple support structures, tying areas, and having some network like structure for the ventilation and allowing certain amount of the free movement of the mouth. So this kind of a splint in the neck is the Mutoli Bandha. Vritte Ange Mandalam. Mandalam is simple spiral turn where only the continuous bandage, instead of prolonging it to the wider area, it could be just locally at the area, simple bandage. A tying of the area is a Mandalam. Mandalam Vestanakaram Vidhyata. Angustanguli Metragesha Stagika. Stagika and the Koshabandha, they are similar. The only difference is in the Koshabandha you will have a rigid capsule. In the Stagika Bandha, you will put a bandage with the cloth, which will be more flexible. So when there is no need of splintage at the tip of the finger, then Stagika Bandha is used. When there is a need of splintage, then the Kosha Bandha is used as such. Otherwise, their shape and functions are similar. Yamala Pranayoho Yamakam. When there are two wounds and two wounds are to be covered with a single bandage, that's considered as a Yamaka Bandha, a twin bandage, where you may move in across a joint. Badhyate Mandalakaraha, it's also primarily it's Mandala Bandha because it's a continuous bandage, but when it is covering two wounds across a joint, then it's considered as Yamaka Bandha. We often use this kind of bandage, particularly when you bandage the foot. Is a small wing of that bandaging cloth is applied around the ankle so that the bandage gives a support. That kind of a bandaging is a Yamaka Bandha, where the location could be covering two areas. Hanushankha Gandeshu Khatwa. Khatwa is caught and having four legs, something like exactly the mask which is used is the Khatwa Bandha. Khatwa Karaha Chatushpadaha Khatwa Bandha. It has four limbs, exactly like the mask which you use. Now you have many modifications of mask, and of course now these days everyone is very popular with the mask as such, and it's used to cover the face, the structures of the face. Hanu Shankha Gandeshu Katwa. Apanga Yoho Chinam. For the apanga, covering of the eye and the angles of the eye, China Bandha is used. China Bandha is something like the eye coverage which is used, like China Bandha Mijanya, so Kira Bahubiputam. It's mainly soft and gives some amount of movement, doesn't produce much pressure. That's Apanga Bandha. Prishta Udara Urasu Vibandham. Vibandha is having multiple layers of the bandage which gives a rigid support, but at the same time somewhat flexible. Unlike that of a rigid support of a capsule, this gives some flexible, and it's exactly like the lumbosacral belt. In the lumbosacral belt, you use similar materials where there will be many ties like Veda Bandha, and having thick support, thick material, so that it gives sufficient strength too. At the same time, it will be somewhat flexible. Pristha Udara Urasu. In the chest and the abdomen, that some amount of the movement is still required. It cannot just total rigid bandage. You use this kind of the vibandha. Murdhani Vitanam. Vitana is a mundas, the covering of the head, and This is in the murdha over the scalp, and that's one of the difficult areas of the bandaging. The most difficult areas to bandage are the skull and the scrotum. These are the two difficult areas to bandage in the practical uses. And Vijana Bandha, something like a headgear, the mundas which is used, is used for the murdha. Jnaya Vitana Sanyasto, Vitanakara Sanyataha. Chipuka Nasa Samsa Bastish Gophanam. The Gophana Bandha is having three tails, one or two horn-like structures, and the one's tail. The original Gophana is used for this cow shooter, used in the hunting. And that's a Pashana Godokokshepa. Pashana Godokshepa Gophanam Vidu. Gophana is the Pashana Godokokshepa. That's the shooter. Tadakratim Vishakudyada, Gophana. The Gophana Bandha is what we call as the T bandage. We use the word T bandage now, and quite frequently we use it now. T is suggesting of the same shape, the three arms, the one superior arm and then the two lower arms. Of course, more sensitively, we may call it as Y, and Y and T have very minimal difference. Jatlo Urdhva Panchangi Miti. Panchangi Bandha is for the tight bandage, giving a rigid support over the skull. A Vitana Bandha gives just a support, but it doesn't give a rigid or tension, pressure. When you have to apply the bandage with a pressure, then you will use a long bandaging cloth, and there will be many movements, many folds or movements of that bandaging cloth in different directions. That's called as Panchangi. And Sushruta says at least 5 movements. When you say Panchangi, it can be more than that. So this kind of a bandage applied for compression of the area and giving support to the skull is still we use this kind of a bandage, and that's the Panchangi Bandha. These are the basic qualities of the bandhas are mentioned by Sushruta. And this shows like how careful he was and how innovative Sushruta was in practicing the bandha classification. Of course, an ideal wound dressing material should have the properties. This is from the contemporary science, like it helps in removing the exudates, it should control the moisture, it allows for the gases to transmit the air, it should not be airtight, gives a mechanical stability, and it should not be adherent to the skin much and should not produce necrosis and reduces the wound necretion. It helps in reduction of the pain, should not be toxic. Of course, cost efficiency is one of the issues. Then the other is it prevents the infection, it should be biocompatible and biodegradable. These are the qualities of a bandaging material. Any of the material which can be used for bandaging should have these qualities as per the present situation, and that's what Sushruta says. 𝐿𝐴 Sharira Pradeshe Sunivishto Bhavati Tam Tasmin Vidyatyatah. So you may use any of the bandaging material which is available now. Sushruta has given you all the permission. Now, in Sushruta's period, there was no question of adhesive tapes, and hence the bandage had to be tied, and that technique of tying is another of the issue. Whereas in the present day situation, when you use the leukoplast, even for a conventional bandage, there is no need of tying. At the end, you just put a piece of leukoplast. So this looks like somewhat less important in the present day situation. Whereas from Sushruta's situation, where there was no adhesive bandage, this is important. Yantranam urdhvam adhasthiryacha. When you tie the bandage, that knot of the bandage should not be applied over the wound. It could be either above the wound or maybe on the inferior surface of the wound or in between, so that there should be no compression of the wound. That's na vranasya upari kuryat granthim avadagaramcha. If at all you apply that knot over the wound, it gives a pain and it can affect the healing. Now, before you put the bandage, there should be a medicated this flap to be applied, and that's called as ghana kavalika. Kavalika is a layer of medicine either covered with a bandage, cloth or some leaf, or at times it could be directly the kalka applied. So a kalka is applied or kavalika is applied over the wound, and then Vamahasta Prekshepam Rujum Anavidam Asuputam Rudu Pattam Nimeshabadhyata. So after that, there should be a piece of cloth kept over so that it acts as an absorbent. It reduces the discharges, and then you tie the bandage softly, coolly as it. Nate Vikeshika Aushade Atisnigdhe Atirukshe Vishameva Kurvita. Yasmat Atisneha Kledaha, Rauksha Chedaha, Durnyasat Ranavatma Avadharshanamiti. When you keep that wick or that medicated gauze, now in the present day situation, we keep directly a gauze which is dipped in medicines, lotions or taila. Or Sushruta had used even kalka. In some conditions, even you may use kalka, even now. And when you apply this, it should not be too oily or too much moist, not too dry. And when you apply, it should be uniformly applied, because if you apply it too moist, then it increases the discharges. Atisneha kledaha, rokshat chedaha, a dry gauze can produce injury to the tissues. Dunyasat, if it is not kept uniformly, it can produce friction over the surface and affect the healing. तत्र व्रण आयतन विशेषात् बंध विशेष त्रिविधो भवति गाढः समः शिथिलः इति. Based upon the type of the wound and then the location, the grip of the bandage could be of three categories. That's considered as gadha, sama, shitila. Now this also is quite critical when you tie the bandage, but when you use these leucoplast-like substances, this would have lesser importance. Now but the scientific basis behind this kind of a classification and the detail to which Sushruta has gone in wound healing, that needs to be appreciated. The Gada Bandha is defined as Pidaya Narujo Gadaha, when it produces a sense of compression but not the pain. When you tie the bandage, it should produce a sense of compression but not the pain. That's considered as Gada Bandha. Swachhasaha Shitila Smritaha, when there is a sufficient space for the movement of the air in between, then it's considered as a Shitila Bandha, a loose bandage. Naiva Gadaha na Shitilaha Sama Bandha Parikirtaha. Samabandha is when it's neither too tight nor too loose, so there is not much of a space. That's considered Samabandha, and in majority of the situations, Samabandha is preferred. But based upon the location of the body as well as dosha, in case of the areas where the body has a more range of movements, the movement is more, and chances of the slippage of the bandage is more, like speak kukshi kaksha vamshana guru shirasu, in the buttocks, in the abdomen, or inguinal area, or axilla, or the chest or head. These are the areas which are exposed and chance of more movement is there. The Gada Bandha is preferred. A relatively tight bandage is used. In periphery limbs, Chakha, Vadana, Karna, Kantha, Metra, Mushka, Prastha, Parshva, Udara, Urasu, Samaha. Samabandha is applied in the periphery as well as in the other relatively less moving areas of the body. The areas like eyes, which need to have protection, and the areas like joints, which has to be allowed, the movement has to be allowed. In a joint, you may have two options. Either the movement has to be reduced. When the movement has to be reduced, it has to be the Gada Bandha. When the movement is to be allowed but you want to cover the wound, then it should be Shitila Bandha as such. Now, based upon the doshas, again, these variations can be changed, because in case of the Pittaja Vyadhi, there will be more discharge, and hence, Tatra Paitikam Gadasthane Samambadhyate, if there is a Pittaja Prana in a Gadasthana, like the Kaksha, Vaksha, Vamshana, etc., then it should be Samabandha. Samasthane Shitilam, if it is a Samasthana, a wound is present in the Samasthana, like the Shaka, Pittaja Prana is there, then it should be Shitila Bandha, the loose bandage. Shitilastani Naima, a Pittaja Varana in a Shitilastana need not be bandaged. Evam Shonita Dustanta, even a Rakta Dustavrana, it's the same, because in Rakta Dusta and Pitta Dustavrana, discharges are more and the discharges should not be obstructed. You should facilitate the discharge to flow out. Whereas Kafaja Vrana, because there is a thick slab, then there is need to more rigid support. 𝐶𝐿 Shitilastane Samam. A Kapaja Prana in a Shitilastana, it should be Samabandha, Samastane Gadam, and Gadastane Gadataram Va. In Vatada and Kapaja Prana, the bandage has to be more tight than what's suggested according to the location. This is another very important issue, which practically doesn't have much value in the current situation, because we use leucoplasty in every conditions. Again, according to the season, Tatra Paitikam Sharati Grishme Dviraha no Badniyata. In Paitika Rutu, that's warm seasons, the bandage has to be done twice in a day, whereas Ratopatutam Evam Apyevam, when there is more discharge like Rathadusti, also it has to be the same. Shrashmika Hemanta Vasanteva Hutrehata, in Kapaja Brana and in the cold seasons, it could be once in 3 days. Vatopudrutam api evam. In Vatajavana conditions too, it could be the same, once in 3 days. Of course, in warm seasons, it should once in 2 days. That's what's suggested by Susha. Not twice in a day. It's the 2 days, once in 2 days. Evam abhyushya bandha vipadiyante kuryata. That duration or frequency of changing the bandage could be based upon these your observations in the clinical, and practically what you do is when there is more discharge, the frequency of bandaging is increased. When the lesser discharge and the wound is in the healing phase, the frequency of bandaging can be reduced so as hygiene is maintained, but the healing tissue is not affected. तत्र समशिथिलस्थानेषु गाढं मध्ये विकेशिक औषधनैरत्यं शोभवेदनाप्रादुर्भावश्च गाढसमस्थानेषु शिथिलं मध्ये विकेशिक औषधपतनं पट्टसञ्चारात् वर्म अवकर्षणम् इति गाढशिथिलस्थानेषु समं मध्ये च गुणाभावः. These grips which are suggested and this permutation and combination of the dosha, they are quite critical. If you do not follow, then the whole purpose of the bandage will be lost. If you have put a tighter bandage, then it can produce more pain, and the use of this Vikeshika Aushadha, that applied medicine, may not be reaching to the target or may not be sufficient. When it is lesser than, the looser than what is suggested in a Shitila Bandha, the Vikeshika Aushadha Patanam, the medicine may be lost and there could be friction of the area. And hence, Aviparita Bandha Vedana Prashanti Asarprasabha Madhavacha. If you have applied the bandage in a proper manner, then it can help in reduction of the pain and it also facilitates the healing. Abandhyamana, if you do not put the bandage, Damsha Mashaka Truna Kasta Upala Pamshu Shita Vatasapa Prabhutihi Visheshehi Abhihanyate Vranaha. The wound getting exposed to the exterior can be affected by contamination of any sorts, insects, grass, or depending on lifestyle, and that contamination can be prevented by bandage. Vividha Vedanapatasya Dustatamupiti. Because of the exposure, the wound becomes a dustavana. The involvement of doshas would be increased because of the wound exposure. We say infection, the wound gets infected. Alepanadinicha asya vishosham payanti. If you do not put the bandage but apply lepa only, then or maybe ointment, etc., that they get dried up and they do not produce the sufficient results. And hence, churnitam, machitam, bhagnam, vishlistam, atipatitam, astisnai, sirachinam, ashubandhena rohati. Even in those injuries where there is a gross injury, the bandage can help. In case of the bhagna chikitsa, the word bandha is used, and there again that bandha is almost similar variety, but there the bandha is only the rigid support. So even that bandaging in a fracture condition has a purpose of immobilization, and that rigid support is there. And there again the similar principles are used, but the material used is more rigid, but even in that condition, the bandaging can help in the management of the fractures too. Sukham evam pranishete, sukham gacchati tishtati, sukham shayasanastasya kshipram samrohati vranaha. By putting a proper bandage, the comfort of the patient would increase and patient can have all his normal day-to-day activities with the comfort. The bandaging should not be done in abandhyaha, pitta raktadigata vishanimittaha. यदा शोफदाः पाकरोगतोद वेदना अभिभूताः क्षाराग्निदग्धाः पाकात् प्रकृतित प्रशीर्ण मांसाश्च भवन्ति. कुष्ठिनाम् अग्निदग्धानां पीडका मधुमेहिनां कर्णिकाश्च बुन्दुर्विषये विषजुष्टाश्च ये व्रणाः मांसपाके न बध्यन्ते गुदपाके च दारुणे स्वबुद्ध्या चापि भजेत् कृत्यांश्च बुद्धिमान्. देशं दोषं च विज्ञाय व्रणं च व्रणकोविदः ऋतुंश्च परिसङ्ख्याय ततो बन्धान् निमेषयेत्. Bandha is avoided according to Sushruta in case of acute inflammatory conditions where the inflammation is acutely progressive. Bandha is not applied. Of course, you may still cover the wound from the practical point of view, but you are not supposed to obstruct the flow of the contents. So many times in such conditions, we may prefer to keep a drain and then cover the area so that there will be compromise. Sushruta has not suggested that drain, but Sushruta has suggested about keeping the wound open. Now, in those wounds where there is more severe inflammation and lots of slough, now in the present day situation, you have many techniques like vacuum suction, vacuum coverage, where a bandage is connected to a vacuum pump so that there is a continuous drainage of the pus. So the same purpose is achieved by a sort of different technology instead of keeping the wound open. Keeping the wound open can produce lots of discomfort to the patient. Of course, If you have maintained the hygiene and keep the wound open, definitely that's a better option. But it's not practically possible, and hence now we have options of keeping the wound covered at the same time facilitating the drainage. Different sorts of such materials are used now. Whereas Sushruta had preferred to keep the wound open, particularly in all those conditions where there is a acute inflammation and profuse discharge or lots of necrosis of the tissue. These are the conditions where, or of course, another is a poisonous contamination. Vishanimita. When there is a poisonous contamination, Sushruta suggests that the bandaging should not be done. Whereas in the present day situation too, whenever there is a poisonous contamination, it's always better to remove the poison, wash up the wound, than really cover the wound. ऊर्ध्वं तिर्यक् अधस्तात् यन्त्रणा त्रिविधा स्मृता यथा च बध्यते बन्धः तथा वक्ष्यामेषेषता घनां कवलिकां दत्त्वा मृदुचैवापट्टकं विकेशिकाम् औषधं च नातिस्निग्धं समाचरेत् प्रक्लेदयति अतिस्निग्धा तथा रुक्षाक्षिणोति च युक्तस्नेहारोपयति दुर्न्यस्ता वत्मघर्षति विषमं च व्रणं कुर्यात् स्तम्भयेत् श्रावयेत् तथा यथा व्रणं विदित्वा yogam vaidyapeyajayat. This is repetition of what we have told in the form of a shloka. It's the same like the bandha. This yantrana has to be, the knot has to be kept in the three, it could be in any of the three places, and you have to have a kavalika, and the kavalika has to be protected. Pittaje raktaje vapi sakrateva parikshevet asakrit kapaje vapi vataje ch vilikshanaha talena pratipijata sravet anulomata. These are all the summary of whatever you have discussed in the form of a shloka. In pittaja raktaja vyadhi, the frequency of bandaging would be more, whereas in kapaja vataja vyadhi, frequency is lesser. सर्वांश बंधान गूढ़ांतान संधींश विनिवेशयेत वोष्ठस्यापि एष संधाने यथा दिष्ट विधि स्मृता. Probably there was a question like in Vosta Sandhana, when there is a lip wound, how to put the bandage. Sushruta has said it has to be applied. The bandage has to be applied, even if we are not able to open the mouth. The bandage has to be applied, keeping in mind the nourishment of the patient. So there you have to use your intelligence. Buddhya, utpreksha, abhiktena, tasacha, astishu janata. उत्तिष्ठतो निशन्नस्य शयनं च अधिगच्छतः गच्छतो विविधैः यानैः नास्य दुष्यति सवरणः. You have to put the bandage in such a way that, considering the lifestyle of the patient and requirement of the movement, the bandage has to be applied intellectually, so that the patient would be protected. एतस्य मांससंस्थाः एतत् पद्गताश्च तथा व्रणाः सन्ध्यस्ति कोष्ठप्राप्ताश्च शिरास्नायुगतास्तथा तथा अवगाढगम्भीरः सर्वतो विषमस्थिताः नैते सारितुं शक्याः ते बन्धात् भवन्ति. Deep-seated wounds cannot be managed without the bandage. This is the summary asset. With this, we conclude. It is Sushruta Samhitayam Sutrasthane Vranalepanabandhavidhyadhyayah Nama Ashtadashodhyayah. Of course, advanced concepts of the topical use of medicine are described in this chapter. Multiple options of dressing materials and techniques of bandaging are the core competency of surgeons. With this, we conclude today.